Hello, dear viewers. Did you know that some tests after the age of 70 are a trap? They can do more harm than good. Let's figure out once and for all which ones. Fifth place PSA test. For prostate cancer, more harm than good. This test measures the level of prostate-specific antigen in the blood. It seems like a good idea to detect prostate cancer at an early stage. But here's the truth. PSA can increase with age even without cancer. Very often, the test shows something suspicious, but it is not cancer. It is an enlarged prostate, which almost all men over 65 have. People panic, undergo a biopsy, which is painful, sometimes surgery. And this is not only unnecessary, but also carries risks: impotence, urinary incontinence, infections. Often, after the age of 70, prostate cancer grows very slowly and does not pose a threat to life. Conclusion: if there are no symptoms, frequent urination, pain, blood, PSA should be discussed with a doctor. But don't do it automatically. Fourth place colonoscopy, after 70, only if there are symptoms. This is an invasive examination of the colon. It is often prescribed annually or every few years, but after 70, the risk of complications increases. Intestinal perforation, bleeding. Preparation for the procedure is extremely stressful for the body. Strong laxatives, fasting, anesthesia. Many people have already had previous clean results, and the chance of finding something new is very low. And another thing, many polyps or growths found are not malignant and do not require intervention. Conclusion: if there are no symptoms, blood in the stool, weight loss, pain, it is better to choose non-invasive methods, stool analysis for occult blood, or new DNA tests. Third place, X-ray fluorography of the lungs, pointless without symptoms. This test is a legacy of Soviet medicine. It is prescribed to everyone and always. But an X-ray is radiation. It is undesirable, especially when it is not necessary. In people over 70, the results can be false positive. For example, scars after pneumonia or old calcifications are not cancer, but they look suspicious. As a result, you are sent for a CT scan, MRI, or bronchoscopy. And it all started with a preventive X-ray. Conclusion: if there is no cough, shortness of breath, or weight loss, there is no need to scan anything. Careful listening to the lungs is sometimes more effective than a film. What do you think? What tests were you prescribed, and did you refuse them? Was it the right decision? Write in the comments. It will help other viewers. Second place, vitamin D testing. Overrated and unreliable. This test is now prescribed to almost everyone, especially older people. But it's not that simple. Let's figure out what is really important here, and what is just marketing and fear-mongering. First, unstable results. Vitamin D is a fat-soluble hormone that fluctuates very easily. It depends on whether you have been in the sun, when you last ate fatty foods, even on the season. The same test, taken in summer or winter, can differ by a factor of 2. Laboratories use different methods. One will show you a deficiency, while another will show you a normal level. Secondly, not every low level prostate problem. In people over 60 to 70 years of age, a decrease in vitamin D is a physiological norm, not necessarily a disease. Our bodies change, and a level of 20-25 nmol may be quite sufficient. But feeling unwell due to a deficiency is another matter. In other words, it is not the number in the test that is treated, but the person with specific symptoms. If you have no complaints, you should not consider yourself sick just because of a piece of paper. Thirdly, the danger of overdose. People often, upon seeing a deficiency, begin to prescribe large doses for themselves, 4,000, 6,000, 10,000 units per day. But vitamin D accumulates. Its overdose is not a myth. It can lead to kidney dysfunction, loss of appetite, weakness, and even heart rhythm disturbances. Fourth, there is a natural alternative. If you walk in the sun and eat eggs, fish, and liver, your body gets enough vitamin D. There is no need to fanatically measure your levels every month. It is much smarter to maintain balance through diet, exercise, and sun exposure. When should you get this test done? If you have osteoporosis or frequent fractures. If you are sick for a long time, have constant fatigue or depression. If your doctor suspects a serious deficiency, then yes. But, just in case, no. It's a waste of money and nerves. Conclusion: vitamin D is important. Yes, but chasing the perfect number in a test is medical hype. After 70, the main thing is not the test, but how you actually feel. Don't take supplements blindly, and don't be afraid of numbers. Listen to yourself. You are the best diagnostician in old age. First place, full MRI of the entire body. A modern trend that is misleading. Many private clinics now offer a full body scan, i.e., an MRI of the entire body in one session. It sounds appealing. We will detect cancer at an early stage. We will check all your organs, from head to toe. Just 40 minutes, and you will know the whole truth about yourself. But the truth is different. First, an MRI is not a preventive measure. It is not a magic camera that will find all problems. In many cases, the device detects things that are not dangerous. Small cysts in the liver, nodules in the thyroid gland, changes in the spine that appear in 90% of people over 60. And then what? You are referred for new tests, biopsies, consultations with an oncologist, and it turns out that it is completely harmless. Secondly, false alarms. A full MRI often shows something suspicious that has no clinical significance, but the doctor, in order not to take any risks, starts digging. The result is that you go from office to office, take a bunch of tests, spend money, get stressed out, and most importantly, ruin your mood. And then you hear, "No, it's nothing serious. You can leave it alone." Thirdly, it's not cheap. A full MRI is not cheap. In some centers, the price reaches 10,000, 20,000 hryvnia, and the result is just a list of findings, 90% of which are trivial. Fourth, it is not a guarantee of health. Even the most modern equipment cannot see everything. Some types of cancer are not visible on MRI at all. Small growths can also be hidden. And if, after the scan, you start to think, "I'm completely healthy," that's a false sense of security. When is an MRI really necessary? If there are clear symptoms, pain, weight loss, feeling unwell. If the doctor prescribes it to clarify the diagnosis, not just in case. If there is a chronic disease that needs to be monitored, e.g., intervertebral hernias, tumors, neurological problems. The conclusion is simple. MRI is a wonderful tool, but only when used correctly. Doing it just in case is playing with fire, expenses, anxiety, and the illusion of control over your health. In old age, the main thing is not to check everything, but to maintain peace of mind, joy, and quality of life. And health is not an MRI printout, but how you feel every day. Health is not about the number of tests. After 70, the most important thing is not to run to the doctors every month, but to choose wisely what you really need. Don't be afraid to give up the unnecessary. Less is more, and in good time. Subscribe to the channel, like it if you believe that age is not a sentence, but a chance to live wisely. And write in the comments, what tests have you decided not to do after 70?